for attending today on a beautiful, beautiful day here at Ed's house. It truly is crazy to believe that we're in deep into November now. I really appreciate you all taking time out of your very busy days to join us. And I think, as Trish mentioned, the number of people here is a real testament to the important role that Ed's house plays in binding our community together. It's really a tie that binds us as a community, and healthcare is something that Northumberland is, of course, no stranger to, and healthcare really does bring our community together. We're on the heels of an exciting hospital gala that just happened last week, and I know so many of you get up each and every day. Government has invested over the past year $23 million to help residential hospices across the province provide high-quality, compassionate end-of-life care and to help people and their loved ones. This funding is in addition to the annual investment of over $74 million per year in palliative care. And this investment this year ensures that all hospices will receive a minimum increase of over 30% to their bottom line this year alone. COVID pandemic has been difficult on all of us, but it's been difficult on those providing care in our community. They shouldn't have to worry about the challenges of COVID while providing compassionate care to others. And that's really our job as public policy makers and as the government, is to stand behind you and to support you in the work that you do on a day-to-day basis. So again, a thank you to the staff, to the board, to our municipal leaders who are here today, our healthcare professionals, clinicians, healthcare frontline healthcare professionals. We're grateful for the work that you do every day. I've had the opportunity to get out in our community and sadly, but also happily, to speak to families, to friends who've been here in Ed's house. And at a very difficult time in one's life, it's comforting to know that they have dignity in the end of their life, as difficult as that time may be. I think to some friends of mine who've been in here. And so again, we're grateful for the work that you do. But I'm proud to announce today, and in the pandemic, that the government is standing behind Ed's house and hospices across Ontario, and that community care in Northumberland will receive a one-time increase of $285,000, which represents a 45% increase from last year. And this brings 2021-22 funding to over $915,000. And we know that over the pandemic, you've experienced a decrease in community engagement. Those awkward conversations about how you do the fundraisers and trying to pivot and think to how we're going to raise money in our community amidst the challenge that is the COVID-19 pandemic. But you've all done it with dignity, with grace, and the government will stand behind you to support you in providing the funding that you need. Since 2018, the Ontario government has invested over $40 million to add over 200 new hospice beds across the province that support high-quality care to more than 7,000 additional patients every year. And we're very fortunate in Northumberland to have Ed's house. We've also got Warkworth, of course, the Bridge Hospice. I was recently there, nestled amidst the rolling hills that are Northumberland. All of you together work collaboratively. We're very fortunate in our small county to have such an integrated and collaborative group of healthcare professionals who work so closely together. Once opened, those beds have been supported by an annual investment of $23 million in operating funding across the province of Ontario. To date, 149 beds have been opened and are supported by $15.5 million in annual funding across the province. The province has increased dedicated investments in hospice expansion and palliative care, quality improvement initiatives from $67 million in 2018 to over $74 million in 2021. This represents a 10.5% increase. We know that the Bridge will receive a one-time increase of $142,500. This represents, again, a 45% increase to the Bridge Hospice. We do incredible work there as well. So again, I'd like to thank the frontline healthcare professionals for the work that they do. We're transforming the way we provide care. Believe me, public policy makers, this is not an easy task. Any politician who says to you, we've got all the answers, be wary of that politician, because we don't. but through open ears, through a commitment to engaging. I think at one point or another, so many of you have come either in the office or I've joined you out in our community, and it's through you. You make us, I think our municipal leaders here, you make us better public policy makers by engaging us. So I'd like to thank you for doing that, for working with government. We're not always going to agree on everything, but you make your public policymakers and politicians in an increasingly polarized world, you make us better at our job by engaging us. So I want to thank you for doing that, for your commitment. Trish, you've always been a stalwart advocate, and I appreciate all the work that you do to improve hospice care. So again, thank you for the work that you do. Thank you for having me here today. It's a real honor to represent you. Thank you.
Money to help open the 6 beds here in Hamilton Township. So on that note, I would like to ask our warden, Craig.
Based health care services necessary to ensure a strong and vibrant Northumberland. Since opening its doors just over 1 year ago, Ed's House Northumberland dependable source of support and comfort. Compassionate, end-of-life care strikes a chord in all of us. And this has been reflected in how for people across Northumberland to access. Compassionate, end-of-life care. As a place of refuge, Ed's House has had an immediate and meaningful impact on our community, offering dignity and care for people facing a terminal diagnosis and for their families. On behalf of Northumberland County Council, I'd like to thank the province for this timely investment in such an indispensable service for our community. Thank you very much.
On behalf of Hamilton Township Council and our staff, I'd like to welcome you here to truly beautiful Hamilton Township. I'd also like to acknowledge the fact that our CAO, Arthur Anderson, is with us today. Thank you, Arthur, for being here. I'd also like to add my thanks to the provincial government for this funding announcement, and in particular to our MPP, David Piccini, for his continuing advocacy for ratepayers of Northumberland and St. Peterborough. Thank you, David. Ed's House has been a truly wonderful addition to our community. I'm a lifelong resident. I won't tell you how many years that is, but it's a big number. I've met a lot of people and friends and acquaintances, and in recent months I've had several conversations about Ed's House with those people, one as recently as yesterday. Without exception, their praise is just so high for the work that's being done here. They often start out with describing the beautiful physical setting, but without exception, they all mention the high level of staff care that their family members get when they come here, and the cooperation that they get from staff. So you can pass that along. I hear that continuously, Sherry. Continuously, I hear the same thing.
Thank you.
Just one short story of one close friend. He attempted to provide palliative care for his mother at home. I can't imagine even making that attempt, but after a number of weeks, he just simply was physically, mentally capable of carrying on, and he decided that he would take advantage of what is offered here at Ed's House. He told me that the whole time that he was bringing her here, he felt guilty. He felt like he was making a mistake. And then he told me later that the only mistake he made was not bringing her here sooner. And that's the kind of effect that you're having on the people in our community. So I'll just conclude by saying that all levels of government, David, municipal, provincial, federal, get our fair share of criticism for the way we spend taxpayers' money. But I think you nailed this one this time. You're not going to have a whole lot of people upset.
We love to hear those stories and testimonials. And we hear I know the staff hear those consistently every day. I would now like to call
The board of directors, that many of them are here today at Ed's House. I'm thrilled to be here for this very special announcement once again. When we as a board at Community Care Northumberland started to talk about a hospice a few years ago, we didn't anticipate the pandemic. I don't think obviously nobody did. So we've really been through somersaults over this past period of time. So despite the pandemic, we were able to open Ed's House on time. For the past year, we've done exceptional care to 110 residents and their families on this end-of-life journey. And this is due to the compassionate care and the tremendous commitment from the staff and the volunteers at Ed's House. So on behalf of the Board of Directors of Community Care Northumberland and the Ed's House Foundation, we'd like to thank Minister Piccini and the Province of Ontario for the additional one-time funding to support our increased operational costs during this past year. Thank you.
Yeah, that's right. We're all smiling at
Chris, tell me a little bit about today's event and how happy you are.
Well, it's great news today. The province of Ontario was here represented by our Minister David Piccini to provide one-time funding to Community Care Northumberland of $285,000 to help in our hospice residents. So this will be to to help out with some of the increased costs due to the pandemic. So increased staffing costs we've had to have, personal protective equipment, lack of fundraising. So our fundraising goals, this will help augment some of that so that we can keep people here in the comfort and compassionate care that we so love here at Ed's House.
Tell me about how it's been. Forgive me, you opened when and how?
We opened the end of September 2020. Sorry, we opened September 2020 and had our first resident admitted. We've had over 115 residents come to Ed's House since that time. So we have 6 beds here. And so we usually have people, about 4 to 6 of those beds are full at any one time. So that's our numbers from then. We have our 4 empty rooms that are still not, we are not funded to operate those. So we just have the 6 beds. So family members, friends have been able to come in throughout the pandemic with certain protocols in place to visit people. But it's been a real benefit to the community.
How has it been for you folks emotionally, even getting through COVID, let alone you're dealing with other things, obviously, but I mean, it must be tough for everybody.
It's very tough, and we have to do testing before people came in for a while, and it's limited numbers, so you are doing restricting people as they come in, so it's been hard. There's always new rules coming out, staff that need to stay home and isolate for various reasons. So it has been a great challenge during the pandemic, but I'll have to say the staff have been great. They've helped develop policies and changed on a dime, and are really it's all about the people that are in the beds and their family. That's our focus here.
How many staff?
Here in the building, we probably have a total of 25 staff. In our clinical area, we would have about 15 staff.
David, tell me about the announcement today, sir.
Well, today's exciting announcement, over a 45% increase in funding to support Ed's House, a one-time funding to support with the increased costs relative to COVID-19, navigating the pandemic. And when you're supporting someone with end-of-life care and dignity in that care, the staff here shouldn't be worrying about challenging, with the fiscal situation and the realities of decreased fundraising with the inability to do fundraising events over the course of the pandemic. So this is a significant increase in funding to support Ed's House. This also builds on the increase in funding the government's provided hospices since we formed government in 2018, and the over 700 additional beds that the province has invested in across the province. So this is really key. Anyone who's ever had a loved one or a friend, myself included, who've come through Ed's House, know you're certainly a changed person when you come out, and the family for the experience. We heard the testimonials today, and we're very fortunate as a community to have such remarkable staff, A, B, incredible collaborations, and C, such an asset in Ed's House. In our community, and of course the Bridge up in Warkworth, the Bridge Hospice. So we're very, very fortunate as a community, and it's just a testament to all of the collaborations and the incredible frontline staff and the work that they do. Any family that has had a loved one here knows the incredible impact that this makes. Dignity in dying, dignity and compassionate end-of-life care.
You're gonna be a kid and you want to visit here, it's nice to have some touches that make it more comfortable for you. TV so that people can sort of sit and you don't just lovely. There's volunteers around, and you can sort of visit with some of the other.
90% scratch.
Yeah.
So
Yeah, that makes a difference.
yeah.
That's all.
Yeah.
Did you make these?
I made everything.
Wow.
Yeah, brownies, except for the chocolate. Brownies, biscuits.
Yeah.
We got stew. I even got a vegan stew for our vegetarian friends. So
Oh, good. Yeah.
we've done gluten free. We've done
That's awesome.
So yeah, it's a pretty neat job.
Yeah.
Oh, come on.
Native lighting where you're not stuck in the It's also so bright and cheerful. Yeah.
That's what we're going for.
Yeah, well, it's working.
Thank you.
Yes.
Well, and that story we heard of somebody wishing they'd come sooner. Did this beautiful painting of the Tree of Life for us.
Yeah.
And you can see there's some leaves that have been placed on it. And every year during National Grief and Bereavement Week, we offer for families of individuals who've had their end of life here to write that name on a leaf if they'd like and add it to our tree.
Al Jacobson. That's great.
So the door on the